Dr. Adeel Khan is a physician who specializes in regenerative medicine, a field that focuses on using customized cell and gene therapies to treat chronic diseases. He explains that regenerative medicine aims to address the root cause of chronic health problems and to provide long-term solutions rather than just symptom management. Dr. Khan shares his experience treating Tammy, Jordan Peterson's wife, for chronic osteoarthritic condition in her forearms using regenerative medicine. He explains that they used ultrasound for diagnosis and intervention and injected Tammy with exosomes, which are signaling molecules that reduce inflammation and promote tissue repair. Dr. Khan discusses the use of mesenchymal stem cells, MSCs, and exosomes in regenerative medicine. MSCs are undifferentiated cells that can turn into various types of tissue, while exosomes are signaling molecules that can send signals to the body to reduce inflammation and repair tissue. He explains that MSCs can be derived from various sources, such as umbilical cord tissue, fat, bone marrow, and amniotic fluid. He also mentions the potential of using gene-edited stem cells to create customized therapies for different chronic diseases. Dr. Khan emphasizes the importance of diagnostic and therapeutic ultrasound in regenerative medicine. He explains that ultrasound allows them to guide the needle directly into the area of damage, such as tears in tendons or joint inflammation, for targeted treatment. He also discusses the use of machine learning and neural networks to train AI systems to distinguish between normal and abnormal tissue on ultrasound images. Dr. Khan highlights the potential of regenerative medicine in treating autoimmune conditions such as lupus. He discusses the use of gene-edited CAR T cells and natural killer cells to target and kill cancer cells. He also mentions the challenges of regulatory approval and the high cost of some gene and cell therapies, which can limit access to these treatments for patients. Dr. Khan acknowledges the challenges in the adoption of regenerative medicine, particularly in the United States. He attributes the lag in regenerative medicine adoption to the influence of pharmaceutical companies, regulatory bodies, and the lack of emphasis on prevention and lifestyle interventions in traditional medical education. He also discusses the need for a shift from pill-based treatments to cell and gene therapies for chronic diseases. Dr. Khan shares his background as a personal trainer and his interest in the role of exercise and nutrition in preventing chronic diseases. He expresses frustration with the lack of emphasis on nutrition and lifestyle interventions in traditional medical education. He advocates for the integration of functional and integrative medicine, which focuses on evidence-based naturopathic approaches and lifestyle measures to treat chronic diseases. Dr. Khan explains that regenerative medicine involves using stem cells and other advanced therapies to treat chronic conditions such as osteoarthritis, fibromyalgia, chronic fatigue syndrome, and rheumatoid arthritis. He emphasizes the importance of addressing lifestyle factors such as sleep, exercise, and stress management in conjunction with medical treatments. He also discusses the impact of chronic pain on mental health and the need to restore the immune system to treat various chronic diseases. Dr. Khan describes the diagnostic process for evaluating patients with osteoarthritis and other chronic conditions. He uses MRI and ultrasound examinations to assess the severity of joint damage and inflammation. He explains that stem cell therapy can be effective for treating inflammatory-based osteoarthritis as well as muscle and tendon tears. He also discusses the development of second-generation stem cell therapies that are specifically targeted for osteoarthritis. Dr. Khan introduces the concept of fecal microbial transplant, FMT pills, which are used to repopulate the gut microbiome and restore the immune system. He explains that FMT pills can be beneficial for conditions such as depression, autoimmune diseases, and chronic inflammation. He emphasizes the importance of early exposure to beneficial bacteria for children and the potential impact of cesarean births on immune dysfunction. Dr. Khan discusses the link between depression and neuroinflammation, as well as the role of the gut-brain axis in mental health. He explains that intravenous exosomes can reduce neural inflammation and address the physiological basis of depression. Additionally, he highlights the importance of addressing unresolved emotional trauma from childhood through interventions such as stellate ganglion block and vas nerve injections. Dr. Khan emphasizes the importance of a holistic approach to patient care, focusing on addressing the underlying causes of chronic conditions rather than just treating symptoms. He discusses the need for personalized treatments based on individual patient needs and the potential for regenerative medicine to revolutionize healthcare. He also emphasizes the ethical and patient-centered approach to medical practice, prioritizing patient well-being over financial considerations. Dr. Khan discusses the use of induced pluripotent stem cells and their potential to differentiate into various cell types for therapeutic purposes. He also mentions the use of 3D bioprinting to create scaffolds embedded with stem cells for tissue engineering, specifically for regrowing cartilage in osteoarthritis. Furthermore, Dr. Khan introduces the concept of gene therapy, particularly focusing on a reversible plasma gene therapy called follistatin gene therapy. This therapy aims to increase follistatin levels in the body, which can inhibit myostatin, a protein that limits muscle growth. He explains that this therapy has shown promising results in reducing biological age and increasing muscle mass in clinical trials. Dr. Khan shares insights into ongoing clinical trials and research initiatives in the field of regenerative medicine and gene therapy. He mentions the importance of conducting Phase 1 and Phase 2 trials to assess the safety and efficacy of these interventions. He also discusses the potential for these therapies to address conditions such as sarcopenia, osteopenia, and chronic inflammatory diseases. Furthermore, Dr. Khan highlights the potential for these advanced therapies to extend lifespan and improve health span, allowing individuals to live longer, healthier lives. He envisions a future where gene therapy and cell therapy can be used to enhance longevity and overall well-being. Dr. Khan introduces the concept of Medicine 4.0, which represents the latest era of medicine focused on using advanced therapies to promote longevity and health. He acknowledges the challenges and opportunities in this field, emphasizing the need for continued research, clinical trials, and regulatory approvals to bring these therapies to the forefront of healthcare.